Scenario 1. A 30-year-old woman presents with a sudden onset of a widespread, itchy rash. The rash is red and raised, and it is worse on the trunk and extremities. The patient also has a fever and headache. What is the most likely diagnosis? Urticaria, hives. Psoriasis. Wart. Lentigo. Lymphangitis. Answer. The most likely diagnosis is urticaria, hives. What is the most appropriate treatment for this patient? Over-the-counter antihistamines. Prescription corticosteroids. Phototherapy. Oral antibiotics. Answer. The most appropriate treatment for this patient is over-the-counter antihistamines. Detailed explanation. Urticaria is caused by the release of histamine and other chemicals from mast cells in the skin. These chemicals cause the blood vessels in the skin to dilate, which leads to the characteristic red, raised bumps. Urticaria can be mild or severe, and it can last for a few hours or several days. The treatment for urticaria depends on the severity of the rash and the underlying cause. In mild cases, urticaria can be treated with over-the-counter antihistamines. In more severe cases, or if the rash is caused by an underlying medical condition, the patient may need to take prescription medications or receive allergy shots. Scenario 2. A 60-year-old man presents with a dark, scaly patch on his scalp. The patch has been growing slowly over the past few months. What is the most likely diagnosis? Urticaria, hives. Psoriasis. Wart. Lentigo. Lymphangitis. Answer. The most likely diagnosis is psoriasis. What is the most appropriate treatment for this patient? Topical corticosteroids. Oral methotrexate. Phototherapy. Cryotherapy. Answer. The most appropriate treatment for this patient is topical corticosteroids. Detailed explanation. Psoriasis is a chronic autoimmune disease that causes the skin to produce too many new skin cells. This results in the characteristic scaly patches. The patient's age and the slow growth of the patch are both consistent with psoriasis. Topical corticosteroids are the first-line treatment for psoriasis. They are usually effective in reducing the inflammation and scaling of the rash. If the rash is severe or does not respond to topical corticosteroids, the patient may need to take oral medications, such as methotrexate or cyclosporine, or phototherapy. Scenario 3. A 10-year-old boy presents with a painless, wart-like growth on his hand. The growth has been there for several months and has not changed in size. What is the most likely diagnosis? Urticaria, hives. Psoriasis. Wart. Lentigo. Lymphangitis. Answer. The most likely diagnosis is wart. What is the most appropriate treatment for this patient? Topical salicylic acid. Cryotherapy. Oral cidofovir. Laser therapy. Answer. The most appropriate treatment for this patient is topical salicylic acid. Salicylic acid is a keratolytic agent that works by breaking down the wart. Detailed explanation. Warts are benign growths caused by the human papillomavirus, HPV. Warts can occur anywhere on the body, but they are most common on the hands and feet. Topical salicylic acid is the first-line treatment for warts. It is usually applied to the wart twice a day for several weeks. If the wart does not respond to topical salicylic acid, other treatments, such as cryotherapy or laser therapy, may be used. Warts are caused by a virus that infects the top layer of the skin. The virus causes the skin cells to grow abnormally, which results in the wart. Warts can be small or large, and they can be flat or raised. Warts are usually harmless and go away on their own within a few months or years. However, there are treatments available to remove warts if they are causing discomfort or embarrassment. Scenario 4. A 70-year-old woman presents with a brown, flat spot on her face. The spot has been there for several years and has not changed in size or appearance. What is the most likely diagnosis? Urticaria, hives. Psoriasis. Wart. Lentigo. Lymphangitis. Answer. The most likely diagnosis is lentigo. What is the most appropriate treatment for this patient? Topical retinoids. Topical steroids. Laser therapy. No treatment needed. Answer. The most appropriate treatment for this patient is no treatment needed. Detailed explanation. Lentigines are common, benign skin conditions that cause brown or black spots on the skin. Lentigines are caused by sun exposure and are more common in people with fair skin. Lentigines usually do not require treatment. If they are causing discomfort or embarrassment, they can be removed with laser therapy or other treatments. Scenario 5. A 40-year-old woman presents with a red, painful rash on her legs. The rash started after she went swimming in a lake. What is the most appropriate treatment for this patient? Oral antibiotics. Topical steroids. Antihistamines. Cryotherapy. Answer. The most appropriate treatment for this patient is oral antibiotics. The rash is most likely caused by a bacterial infection, such as cellulitis. Detailed explanation. Cellulitis is a bacterial infection of the deeper layers of the skin. It can cause redness, swelling, pain, and warmth in the affected area. The rash is usually red and tender, and it may be warm to the touch. Oral antibiotics are the first-line treatment for cellulitis. They are usually effective in clearing up the infection within a few days. Scenario 6. A newborn baby presents with a red, raised rash on their back. The rash is covered with small, white bumps. What is the most appropriate treatment for this patient? Topical antibiotics. Topical steroids. Oral antihistamines. No treatment needed. Answer. The most appropriate treatment for this patient is no treatment needed. The rash is most likely milia, which are small, white bumps that can occur on the skin of newborns. They are caused by blocked sebaceous glands and usually go away on their own within a few weeks. Detailed explanation. Milia are small, white bumps that can occur on the skin of newborns. They are caused by blocked sebaceous glands. Sebaceous glands are oil glands that are found in the skin. When these glands are blocked, they can form small, white bumps. Milia usually go away on their own within a few weeks. There is no need to treat them unless they are causing discomfort to the baby.